Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I'm back in the Sunflower House for a new edition of a very interesting topic. I've been waiting a long time to interview this excellent physician. I'm speaking with Dr. Layth Tumah. He completed his family medicine residency at Western Michigan University Homer Stryker School of Medicine. A leader, he served as chief resident, and he's board certified in family medicine, obesity medicine, lifestyle medicine, and he's got additional certification in functional medicine. Dr. Tumah serves as a staff physician at the Cleveland Clinic Center for Functional Medicine in the Wellness and Preventive Medicine Department, and he's academic and has an assistant clinical professorship in family medicine at Cleveland Clinic Lerner College of Medicine of Case Western Reserve University, where I am a professor in both medicine and OBGYN. And he's certainly a kindred spirit because physicians like Dr. Tumah, who are interested in lots of different areas to try to bring everything together for the patient, is exactly what my passion has been. He was recently appointed as the Wellness Department Lead for Safety, Quality, and Patient Experience at Cleveland Clinic. He plays key roles in several areas: advancing patient-centered care, clinical quality, as well as operational excellence. And so his practice focus is specializing in areas that a lot of physicians in allopathic medicine haven't always been so strong in, and that's evidence-based lifestyle interventions, including nutrition, physical activity, sleep optimization, behavioral health, appropriate use of pharmacologic therapies to manage and prevent chronic disease. And his clinical focus is on something that should be near and dear to everybody's heart, and that's health optimization, weight management, gut health, and expanding not the lifespan per se, but we've talked a lot on this podcast about extending the health span. Welcome, Dr. Tumah.
Thank you. Thank you, Dr. Thacker, for having me in your podcast and for the great introduction.
Well, it's just so exciting to have you because this hot topic about peptides is everywhere. I just came from downtown where I met my husband. He's really a clothes horse. And we went to this men's clothes store, and I'm like, well, we have to be able to get his birthday gift and get the suit and everything ready because I've got to get home because I can't wait to do this podcast on peptides. And the owner is like, well, I'm on peptides. And the assistant's like, well, I want to know about peptides. Everybody wants to know about peptides. So tell our listeners, and we're in like 100 countries, just what's the basic definition of a peptide?
Yeah, peptide is basically a strain of amino acids. It's from 2 to 50 amino acids gets together in a peptide bond, and it works in the body as a signal for specific function. Very similar to the hormone type of work in the body. Peptides has been in medicine for a while now. It's just getting more popular recently with some different type of uses.
Now, insulin is a peptide, right?
Correct. It can be considered as a peptide. It's a little bit, I think it's a 51 peptide, amino acid, sorry. So it's closer to a peptide, so it can be considered as one. And it's one of the first peptides that we've used in medicine as early as the early 1900s. So we've been using peptides for a while now. We have different type of peptides for different usages, but recently I think there was more interest in the different form of peptides, especially the non-FDA approved ones. I think that's what most people refer to peptide for.
Okay. And how about like all the buzz about, the GLP and GIP inhibitors in terms of weight loss? Those are peptides as well too, correct?
Correct. Yes. So GLP-1s, GIP are peptides. Those are the most recent, very famous peptides that we use now regularly. They are FDA approved for multiple uses. So weight loss, they were initially invented for blood sugar or diabetes management, but they were found to offer weight loss benefits. And now we have two versions from very similar medications like tirzepatide, which is the Zepbound for weight loss, or Mounjaro for diabetes. And we have the Ozempic, which is the GLP-1 agonist for diabetes, and which is semaglutide. The Wegovy version is the one that we use for weight management.
So they're the exact same substances, just two different brand names depending on what the physician is prescribing.
So the GLP-1 agonist is basically, this is the semaglutide, which is Ozempic or Wegovy, based on the indication, and the tirzepatide, which is combination GLP-1 and GIP. That's for also diabetes and weight management, and the brand name is different. It's technically the same thing, tirzepatide.
Mm-hmm. Now, there was like a big shortage of those medicines, and I found so many of my patients turning to compounding pharmacies. And as a menopausal hormone expert, I certainly use compounding pharmacies for hormones when what I need to prescribe is not commercially available, which most of the time it is, but like testosterone for women, the doses are all for men, they're not for females. So you either have to use 1/10 the male dose or have it compounded. We use a lot of compounded vaginal DHEA. But compounding's not better. It's just if someone's allergic to it or you need a different dose. But the FDA allowed some of this compounding, is that right? And then have pulled back on it because there was like shortages of these peptides?
Correct. Yeah. Initially, especially when they got approved for weight management purposes, the demand was super high. And this is where compounding pharmacies started to support this shortage by compounding those, either semaglutide or tirzepatide. And we use compounding pharmacies for multiple reasons, but I think also compounding pharmacies have became very popular for that reason, whether to fix the shortage problem or to find a formulation that might be better with less side effects based on the dose. So the lowest dose of those medications could be causing some side effects for certain patients, where we might need to compound at lower dosages. I think this is one of the most important usages for compounding medications. But also, again, even when in the situations where shortage in certain medications, this is where compounding pharmacies could be helpful to support this demand.
And so the peptides are just amino acids that aren't really patented, so that's why they can put them together and make the same thing at a cheaper price. Is that what they're doing?
So the situation with the peptides is basically, as I said, peptides are amino acids. Those are the building blocks for protein. Mm-hmm. So anything above 50 is considered proteins. Peptides are something that we have in our body. They're produced naturally. We break down proteins into an amino acid form. Then our body makes this peptide in the body for certain purposes. So initially, some of those peptides, and this is the major problem was with peptides previously, that we cannot absorb them, or they get destructed in the GI system, so we don't get the benefit of the peptide directly. Mm-hmm. Those companies, they created a way where we're able to use this peptides in a way where our body does not destruct them in the GI system, and now we're able to use them for systemic benefit.
Now, is that how one of my patients came in and said, "Oh, I'm not on injectable tirzepatide anymore. I'm on the oral version," which I think must have just recently come out. Is it somehow put in a substance that protects it from the gut?
Correct. And those companies also basically patent this way of digesting or using this peptides in an oral version, which is a great also use, because before we were not able to use those peptides in an oral version. I don't know if we're okay to mention companies, but Eli Lilly made a new GLP-1 that is not peptide. It's a smaller version of that, smaller than a peptide, and a Fondayo version, which is this is the most recent oral GLP-1 form.
Oh, is that what the person's responding to? It's like exactly not a peptide, but it's oral, so it's similar, but it's not exactly tirzepatide.
It's a GLP-1 agonist, yeah, and it's a very similar, but it's a smaller in terms of the size. So they're now working on how can we administration of these medications in an oral version to make it more accessible for patients. And there were some limitations with the previous versions of the oral Wegovy, because you have to you should not eat after 4 hours of taking the medication. And this new version from Fondayo, basically you should be okay with eating because the changes they did in the new medication.
Interesting. Fun day-o. So it's like a fun day you have,
Yeah,
not eating.
I think that was the reason for calling it this way. Correct.
Oh my goodness.
Yeah.
Like when I go get my nails done, like some of the names they come up for the colors of the nails are so creative. I
Yeah.
think nail polish is still more creative than whoever comes up with these medication names. Some of them
Yeah.
can be real doozies. But
Correct.
I have spent so much of my career advocating for fair and lower drug costs. Like, we talked about insulin, and I talk about insulin in my practice a lot, even though I don't treat type 1 diabetes. I have patients who have type 1 and type 2, of course, in my practice, like pretty much all physicians do. But when I'm describing hormones and the differences of when you lose hormones, like when you lose estrogen, you don't die in 2 weeks. Like if you have no insulin, you're dead in 2 weeks, right? Doesn't matter what anybody did until they started giving animal insulin, then human insulin. Now we give pancreas transplants. So there's like a different hierarchy of hormones, like some that you need for yourself to stay alive, some that are needed to reproduce for society that have maybe other peripheral benefits that are beneficial, like with menopausal hormones. Is it the same thing with peptides, or some that are really critical and some that are just kind of extra?
I don't think that peptides in the form that we're using them now are essential to live, but they definitely serve a very important role. And actually, you can argue that they're saving the healthcare system, especially in America with the obesity pandemic. So they do serve a very good role in that. They do help with managing the cholesterol, the insulin sensitivity, the metabolic syndrome, which is including the cardiovascular part of it, which is the leading cause of death in the world. So they are helpful for the long-term goal versus I agree with you. Insulin is something that you probably need for the short term as well. Yeah.
So when I started my practice and was in the menopause clinic seeing women, I would see some complicated patients, but the degree of illness and burden of chronic disease now is so exponentially greater. Like I hardly had anyone in my practice that had insulin resistance, metabolic syndrome, metabolic associated fatty liver disease. I mean, I saw a couple of women who had liver transplants from cirrhosis because of this metabolic issue. Why do you think that it has skyrocketed so much in America? Sick people being so chronically ill with so much burden of disease.
I think there are multiple reasons for this. A lot of it stems from the behavior aspects, as starting from the diet, from the lack of exercise, from the chronic stress that we deal with, and poor sleep, and all these things accumulate and driving this chronic conditions and metabolic syndromes.
And you are listening to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, in the Sunflower House with Dr. Tumah, who is a family medicine doctor, expert in obesity medicine and lifestyle medicine and functional medicine. And we are talking all things peptides, which is just such a hot topic, and kind of going back to some of the basics. What's the difference between FDA approved and non-FDA approved peptides? And does that matter to people listening?
Yeah, definitely. I think this is one of the major things that we need to differentiate in terms of the topic of peptides. The FDA approved peptides, those are medications, compounds that they have been studied extensively on thousands of patients. We're able to establish dosing, safety profile, complications, and contraindications. Versus the non-FDA approved peptides, those are peptides that they have been used in the past. However, they did not go through the same rigorous studies, and especially in humans, and they're not basically prescribed in a regular pharmacy. And I think this is an important point to highlight, just because when we talk about peptides in general, I think most people refer to those non-FDA approved peptides, which we need to understand more before
So probably
we
that
use.
person who made that offhanded comment, oh, I just started peptides, probably it's most likely non-FDA approved, and it's just kind of, you get that information at the
I would
gym,
assume so.
or the gym, or your
Yeah.
friend, or your, I don't know. Where do people like obtain these non-FDA approved substances?
Yeah, so originally, clinicians used to recommend the certain peptides before, I do believe, late 2023 is when we stopped. We were not able to prescribe those or recommend those anymore. Not we, I haven't prescribed those in my professional career, but physicians used to be able to prescribe those and using them from compounding pharmacies. However, the regulations have been changed and they were banned late 2023 till now. So a lot of those peptides or non-FDA approved peptides are not being prescribed in the US from a compounding pharmacy. So if you hear anybody who's talking about peptides, especially for research purposes, they're getting those peptides from online websites. Usually they are manufactured outside the United States, like places like China.
Oh, great.
Mm-hmm. Yeah. Yeah.
So, because when I look at the chronic health burdens and I think, yes, some of it is personal responsibility and people being on screens and fast food and, lifestyle, but it's so exponential that it really makes me think that it's something in the food supply. Like, it just seems like we have so many more inflammatory fats, omega-6s. I've done a podcast on the food substances that are banned in other countries that Americans just can have as much of it as they want, right? And it just seems like this chronic disease, like reinforcement with food, lifestyle, maybe other things in the environment that really make it difficult for people. I've always been leery of online things and not interacting with your physician and getting shared decision-making, informed consent, and the best available, knowledge and options. I've unfortunately had to live a lot of my career with women turning to compounding pharmacies because they thought prescription hormone therapy was not safe and it was going to kill them, which of course, no, the research showed it actually prolonged their health span and lifespan and reduced chronic disease, which of course I could see from the research. And I kept saying that, but it's like you're saying it into the abyss because the culture and what the TV tells them and the media tells them or what they hear at the gym or in their neighborhood coffee klatches seems to have more import than someone who's really delving sometimes into the literature. And the concern is if there's not regulation, you don't know what else they're putting in it, and there's a risk with not having oversight with compounding. Have you seen disaster cases with people getting stuff online from China and other places that are promising improved health?
Yeah, I mean, I get almost every day the question about peptides. Should I do that? Should I try to look for one? And you're right. I think the quality of the product that you get, whether it's a supplement or a medication, is super important. That's why we try to stick with the FDA approved medications because of that, the regulation, the oversight, and all of these things. And I do get concerned when patients try to reach to resources like online, and we don't have really good way of regulating that market, which it's being called gray market. And basically there's a risk that can be associated with this. First of all, we don't know if this is actually the product that they're claiming it is.
Of course.
So there's a risk of contamination, heavy metals, or something called lipopolysaccharides, or toxicity that could be associated with the use of certain products if there's no oversight on them. And I would say this is one of the major concerns. Obviously, other than just we still need significant review for these peptides. We need to study them on humans. We need to have good studies to show safety long-term and short-term, to establish protocols and dosing. And the truth is we don't have this information for now to recommend it in a safely way. Most of the people that have been using them or clinicians that have been recommending or using them, it's more like a personal experience based on other people's experience, which this is not how we practice medicine for everybody. Basically, we make sure if we have, I'm not saying the peptides, they don't work. What I'm saying is in order to prove that they work, we need to study them in randomized controlled studies or research. This is where there's another challenge comes with that too, because as we said, peptides are something that is naturally present in our body, and this is something that you cannot have a patent on. So
right. So there's not going to be big pharma putting big money into doing randomized controlled trials to get that FDA label. right?
Correct. Like the studies for the FDA approval and the studies for these things cost a lot of money. We're talking millions, and if you cannot patent this to make profit, they're not going to be a good interest from the pharmaceutical for obvious reasons. So this is where the challenge comes in here, and that doesn't mean that we should not look into it, and I think we should study it because there is an interest and there's some promising potentials for these peptides. I'm personally interested to see the actual results of these peptides because they're basically promising a lot of benefits for these peptides.
So let's talk about some of the trending ones that I've read about and heard people talk about. So tell me about BPC 157.
Yeah, so actually it's one of the most exciting peptides that they're talking about. It's the body protective compound 157. It's derived from the gastric juices, basically, and it's been studied on animals, not on humans yet. Basically, the claims in terms of benefits, fighting inflammation, healing, wound healing, gastrointestinal benefits, vascular benefits. It's been, or at least that's what we hear about, the benefits on recovery after injuries like tendon injuries and MSK, musculoskeletal injuries, basically. In addition to the GI benefits. But again, those are based on animal studies. We don't have enough data, very, very rare studies, especially on the BPC 157. So when we say there is no
anything for
sorry.
There's still people using it. There's still people using it, right?
Yeah. And again, I think because of all the promises that comes with the use of this medication, this peptide, basically, a lot of people will be curious on the benefit of using it. But again, would you try something that does not have enough data, something that we don't really understand the side effects? It appears to be safe so far on the animal studies, but again, that does not translate necessarily on humans, as we know from our experience with other medications. So, yeah.
Well, I see so many midlife women who have tendinosis, tendon injuries, delayed musculoskeletal healing, looking into PRP and high frequency, sound wave, therapy, really looking for options. So we certainly do need that because the aging body does not recover. And I just see a lot of patients who have a lot of excessive musculoskeletal degeneration. And, they follow all the usual lifestyle, standard vitamin supplementation, etc., and really have terrible trouble with their tendons. Tell me about TB 500.
Yeah, TB 500 is also a naturally occurring amino acids in the body, in the mammals, basically. The sum of the mechanism of actions or the claimed benefits. Same thing in terms of blood vessel formation, cell migration, which can enhance also recovery and healing. Those are the major findings in animal studies. But that's another thing that was not studied in humans either.
Wow, fascinating. And what about ipamorelin?
Yeah, ipamorelin is also a peptide that seems to signal for growth hormone. Yeah, it basically helps with increasing the production of endogenous growth hormone. But this is, again, not enough human studies. All of these things are animal studies, basically.
And then finally, what about GHK dash, I guess that's copper, Cu?
Yeah, so this is another peptides. Interestingly, this one have been studied for topical use, for wound healing and wound repair. But when we say in terms of peptide use in the non-FDA approved form, it's mostly injectable. And for the injectable form, it's also we don't have enough evidence in human studies too, and basically works very similar. It seems like most of the peptides have similar form of the way how they work in terms of angiogenesis, which is making new blood vessels that could help with recovery and healing and anti-inflammatory benefits too.
Because, as I mentioned, I have so many women with musculoskeletal problems, joint pain. They don't want to have joint replacement. They're doing their physical therapy. They're keeping their weight down as best they can, but they have a lot of joint pain. And so I was wondering if some of these skin penetrating ones that don't have to be gotten from a gray lab or black market, online, that just penetrate through the stratium corneum and go directly through the skin, if those might be, I see them over the counter, that people can purchase those. Do you think that there's some benefit in it? Do you think it should be mixed with other things like turmeric or MSM or menthol, or I see also methylene blue. I didn't know if you wanted to comment on that.
Yeah.
Are you recommending any of those for people?
Recommending supplementation or the topical option?
Topical, over the, yeah.
Yeah.
Because to me that seems safer, but if it's still absorbing into your body and you don't know what it's doing, it's still, could be a problem.
Yes. Just for clarification, the GHK copper, it's an FDA approved, so it's an actual medication that's used topically. I don't do a lot of topical supplementation necessarily. I do for sure, like some pharmaceutical topical interventions. It's still absorbed by the body. I'm as you know, like we use a lot of like hormones that's in a gel form that it's absorbed to. In terms of supplementation, that has similar risk. So that's why we try to be also careful with the sourcing of the supplement. There are some supplements that have been studied on in humans. Usually those studies are smaller as well. And we try to focus on the quality of the product, more from a nutraceutical grade, and not to do it for a long time. So there's, again, medications, the pharmaceutical FDA approved process tend to be very extensive, a lot of oversight. You can guarantee the quality of the product, the consistency of the product, making sure that the medication that you have actually contains the what it's supposed to, and at least we understand the side effects and safety way and possible complications for counseling.
Now, this isn't a peptide, it's a solvent, and it was really popular in the 1970s for musculoskeletal problems, DMSO, and I know it's sold over the counter. Is any of that used with topicals to improve the penetration, or do you have any comments on using topical DMSO for musculoskeletal injuries?
I'm not familiar with this one.
Yeah, it's really dirt cheap. I mean, I remember they used to, then the FDA clamped down on it and people thought, oh, it's because nobody can make money off of it and it helps so much with injury. And I remember as a child just driving by gas stations, we sell DMSO. So I just wondered if any of those other things were, mixed in some of this stuff.
Yeah, I think it's the same concept with peptides. It's probably one of the things that made it popular is when they became banned.
Yes,
now
that everybody wants it.
Yeah, everybody wants it now, and we want to try it. And there's probably a reason why they were banned. So it's funny that the same stories keep happening over time.
Yeah, although there is a concern about regulatory capture with the FDA. And so, every decision they made has not been well. I mean, I've worked for over 20 years to get the FDA to lift these ridiculous, scary boxed warnings off of local vaginal estrogen and systemic hormones as well, which show longevity. And I mean, that was just Herculean. It took a new administration to get that done. So while I like oversight, and I think that some of our governmental agencies do a good job, I mean, just like with anything else, sometimes they don't. So it does seem like there's some movement, but there's a lot of controversy about people thinking that they want access to the gray market and they're not getting it. Some other substances is, what do you have to say about methylene blue?
Yeah, methylene blue is actually... and I do believe it's been there even before the FDA. And there is a pharmaceutical use for it in a very, very specific medical conditions. However, it's been used for anti-inflammatory and as a supplement, over-the-counter one. I don't use it as much, but I am aware that it's one of the substances that have been studied previously for its anti-inflammatory benefits or mitochondrial support. Again, I would be very cautious with its use because there might be some interaction with certain medications. So it might be helpful for certain conditions, but under medical supervision.
Mm-hmm. Speaking about things that were around before the FDA, there's an estrogen, a esterified plant-based estrogen with oral methyl testosterone that I prescribe for women, especially women who've lost their ovaries and do need testosterone. Most women don't. I did a podcast on that, but some women, of course, do. And it's so old that it was around before the FDA was. So, of course, they never went for FDA approval. And so a lot of insurance companies won't cover it because it's not FDA approved. And, and we do use a lot of agents off label, of course, even though they have been studied. So you have an idea about the side effect profile in a certain group of patients, but that we as physicians should be able to use FDA approved medicines for different options that they weren't initially studied for, because through our clinical gestalt experience, etc., we have to sometimes come up with that, as well as like repurposed cheaper drugs that isn't going to make somebody a lot of money, but might help patients. But just because something's cheap or something's somewhat banned, it doesn't mean it's going to help you either. And it just makes this whole thing so complex, because people want to feel better and they want to live longer. And, when someone promises you that you're going to be thinner or look better or have bigger muscles or recover faster from the gym, people are just so into this whole anti-aging. The other topic that people ask me about is NAD. And from my understanding from talking to other functional medicine people, the oral just doesn't work very well. It has to be intravenous.
Yeah. I am aware of this conversation with the NAD and all, and its use. I don't use it for my patients, and it appears that the injectable one is more beneficial, but I did not do a lot of reading on it. I think the focus should be a little bit different than looking into those type of interventions, because from what I see, that a lot of people have issues with the basic foundational aspects of health.
Yes.
So the four aspects that I discuss on all of my visits are we eating well? Are we moving on a daily basis? Are we sleeping enough and high quality? And do we have good coping mechanism for stress levels and so forth? And the truth is, if we don't optimize these areas first, the other conversation about any form of supplements is really not super helpful. It does not really move the needle, especially from what I see in my experience with chronic conditions and the complex patients that we see on a regular basis. So yeah, if you master everything in terms of your diet and your exercise and sleep and stress management and social connections, then sure, yeah, we can look into some supplementation, some other ways to add this extra level, but we cannot skip the basic things. And we need to be aware of something that, in my opinion, there's no free lunch.
Yes.
So if you're using a substance that's effective, or a supplement that is effective enough to give you benefits, it is effective enough to cause harm or side effects sometimes. So this is where it's important to have this conversation with your clinician, understanding its use, having regular labs and oversight, just to make sure if you decided to do that on your own or after talking to your physician, we need to make sure that things are stable and safe, and it doesn't cause a lot of complications or interactions with other medications too.
Wow, that's really well said. There's no free lunch. And I do see people bringing in a big bag of all the supplements, which I ask them to bring in. But I do think sometimes people just want to take a pill